Okay, here's what happened to me. I was diagnosed in May 2 years ago. It was a funny thing, actually. After I had a colonoscopy, the doctor noticed there was a firmness in my prostate, and he recommended I go see a urologist, and he recommended Dr. Gholami. So along I came, feeling fairly confident. I was at that time 56. I'm now 58, and I felt very confident that there was nothing wrong. He decided to do a biopsy. He took out 16 samples, one of which was cancerous, and it was a Gleason score 6, and I can't remember the grade of tumour, but it was a mildly aggressive, I think. I didn't know anything about what Gleason meant or scores or anything else, so naturally, like most people, when he told me, I didn't hear a lot. I rushed off to the web, but unfortunately Dr. Gholami had told me to ignore that. I did find lots of people on the web who seem to have a lot of knowledge, but a little knowledge can be a dangerous thing. So I decided to trust Dr. Gholami. He recommended the radical prostatectomy, which was the robotic surgery, which I was kind of fascinated with because I come from a technology background. And we did that 6 weeks later in June. Should I say he did it, not me. And I was actually out of hospital 2 days later. The recovery period was fantastic. There was one big problem for me, and that was the catheter, which I did not like at all. So the day that came out, I was a happy man. But after that, I had no complications. For example, incontinence never occurred. I was working fine. I actually went back to a wedding that I really wanted to go to in Ireland, where I'm from. 6 weeks later, no problem with the travelling, no problem with being Irish, quite a few beers at the wedding, and everything worked fine. Everything was perfect. In all that time, Dr. Gholami was brilliant in answering the questions I had. I decided I would not ask anybody else. I would not go on forums. I merely directed all my interest towards him. And one particular group, the American Cancer Society, were very helpful as well. So they were the only two people I really talked to about it. I did take other advice about using radiology and watch and wait, but I'm not the kind of guy who could watch and wait. It simply would not have worked for me, and I really wanted to get rid of it. The whole experience was, naturally, nobody ever wants to get cancer, so very, very difficult, but was fantastic in another way, in that I was amazed at how quickly I recovered, how well I felt. The confidence of Dr. Gholami and his understanding of the situation was fantastic, as were his staff, just great to me. And regarding erectile dysfunction, it occurred for a while. I kind of expected it. He gave me some medication, but now I'm pretty well back to normal. So all in all, an experience nobody wants to have, but having had it, it was treated fantastically by a total professional team who were as skillful as they were caring, and I would highly recommend anybody who has that problem to come to these guys.